In Spokane County, drug overdoses are on the rise. Substance use treatment providers, police, and first responders all say they are seeing an uptick.
As KREM 2 News explores what is being done to combat that crisis, Shannon Mouty takes us inside Spokane's only drug testing site.
It's difficult for Hallie Burchinal to even describe.
I really thought heroin was the worst thing I'd ever seen and would ever see. I could not have comprehended what we're dealing with today.
The executive director of Compassionate Addiction Treatment says the change started in 2021 when staff discovered 1 or 2 doses of Narcan weren't having the same effect on overdose patients. The change was fentanyl, and now CAT has changed too.
We were seeing such an increase in overdoses, and having the opportunity to begin to identify what's on the street in real time.
Everything I have is something that somebody brought in.
Inside this small office, drug technician Bobby Lee Moskalov tests donated drug samples. For nearly a year now, CAT has been one in a handful of drug checking sites in Washington through the University of Washington's Drug and Alcohol Institute.
This is fentanyl powder.
She's seeing this powder form more and more potent than pills that used to be more common.
All these peaks match.
But it's what else she's finding.
So I know that there's fentanyl in this.
That's cause for concern. This sample also showed carfentanil.
That is a tranquilizer. So that is what they use in Africa in the darts to knock out rhinos and things like that. Very dangerous.
She's also seen xylazine, a non-opioid tranquilizer that can suppress breathing and can't be reversed with Narcan. It's changed how their staff responds to ODs. They'll soon carry breathing equipment like EMTs.
We're experiencing people die on a regular basis. It's absolutely getting worse.
3 years ago, CAT staff saw maybe 2 or 3 overdoses a week. Now it's multiple every day. Burchinal would like to see more local, low-barrier services and providers that understand the intersections of substance use, homelessness, and mental and behavioral health issues.
Abstinence is like the end of all these other things that are needed, housing, mental health, many things.
The nonprofit started sharing its findings with other providers, first responders, and the health district. A collaboration they hope will change this deadly crisis.
And I want to save people's lives.
Shannon Mouty.
That's what I do it for.
KREM 2 News.